Cassidy. I'm a nurse practitioner. Today I'm going to be doing an assessment of your skin, head, ears, eyes, nose, and throat.
Okay.
Before we get started, do you have any questions or concerns at this time?
Mm-hmm.
And I did want to remind you that all information discussed today is private and will remain confidential.
Okay.
I'm going to have you start by verifying your name and date of birth.
Brock Kaiser, 6/24/2000.
Okay, great. Getting started, I'm going to look at your skin. I'm going to look at your arm. The skin color is good. It's uniform, symmetrical, warm to touch. Good hygiene. There's no odor. I don't see any lesions. The hair is evenly distributed. It's very thin in texture, dark in color, which seems pretty consistent throughout. I do note some few tattoos. Those seem to have healed well. There's no raised areas, no lacerations. So those look good. Next, I'm going to assess your skin turgor and elasticity. So I'm going to see your hand. You're just going to feel me pull. Okay, good. So skin returns briskly, which is a good finding. There's no tenting left, no edema of the hands. Moving on to the fingers and the nails. I don't see any warts, cysts, tumors. Okay, there's no clubbing of the nails that I see. You're going to feel some pressure. I'm going to do a capillary refill test. Okay, so good vasculature. Your blood returns very briskly. Looking at the nails, the nail beds, and the cuticles, there's good color. I don't see any abnormalities. Okay, good. Next, I'm going to move on to your head. I'm going to start by palpating your skull.
Okay.
I'm going to feel for any indentations, any bumps, look for any lesions. Okay. This hair is more coarse. I don't see any areas of hair loss, and it's dark in color. Okay, so now I'm going to palpate the sinuses. Let me know if you feel any pain or tenderness during this.
Okay.
So start with the frontal sinuses and the maxillary. Okay, good. I'm moving on to the trachea. The trachea appears to me midline. I don't see any tracheal deviation to the left or right. So I'm going to palpate the trachea. Again, let me know any pain or tenderness.
Okay.
Okay, the trachea is midline. I'm going to feel for your hyoid bone. Go ahead and swallow. Okay, so this is a good finding. When you swallow, the hyoid bone goes up, which is good. I'm going to feel the thyroid from the front first. I'm feeling for any enlargement or nodules. Okay, I'm going to come behind and do the same. Go ahead and swallow. Okay, good. Don't feel any of those.
Okay.
Next, I'm going to feel the temporal mandibular joint. I'm going to feel for any crepitus. So go ahead and open your jaw a few times. Okay. Good. Now I'm going to grab my stethoscope and just listen to your neck.
Okay.
And just breathe as normal. Okay, and this time hold your breath. Good. I'm going to listen to your temporal artery. And over the eyelids. Okay, and I don't hear any bruit. Now I'm going to feel your lymph nodes. Again, let me know any pain or tenderness during this.
Okay.
We'll go through these together. So we have your preauricular, posterior auricular, just behind the ear, okay, occipital. We have your submental, submandibular, tonsillary, anterior cervical, posterior cervical, sternocleidomastoid, and supraclavicular. Okay, next I'm going to assess your range of motion. So go ahead and look up and down to both sides, all the way around. Okay, good. So I don't see any tremors or tics. Moving on to your eyes, I'm going to have you raise your eyebrows a few times. Good. So the eyebrows are both symmetrical, they move symmetrical. The eyes, I don't see any poptosis, no drooping of one eye more than the other. So next I'm going to feel your eyelids. You'll feel me pull them down. I'm looking at your conjunctiva. It's nice and pink. The sclera is white. The lacrimal duct seems to be intact. There's no abnormal drainage. Okay, same with that eye. Next I'm going to grab my otoscope to further look into your eyes. So you're going to feel my hand on your eyebrow. I'm going to look first for a red reflex, okay, which I see. Further assessment of the eyes, I'm looking at your blood vessels. I don't see any broken blood vessels, any that are larger than the others. I'm looking at your retina, your disc, macula. Okay, so the lens are clear. Same thing with this eye, you're going to feel my touch. The red reflex I see, and same thing with blood vessels. I don't see any that are broken. The lens is clear. The macula and disc look good in the retina. Okay. Next, I'm going to use the Snellen chart to assess your vision. I'm going to have you cover one eye, the other eye, and then both.
Okay.
So go ahead and read this bottom line.
FDP LTCEL.
Okay, and the other eye.
FDP LTCEL.
Okay, and now both eyes.
FDP LTCEL.
Okay, good. Moving on to the nose, we palpated the sinuses. You didn't have any tenderness or pain. I'm going to palpate the external nose. I'm feeling the cartilage for any nodules or deviations. Okay, good. I'm going to grab my pen light. You're going to feel me lightly lift your nose. I'm going to look into the mucosa. Okay, good. No abnormal drainage is noted. I'm looking at the lips. The lips are a good color. They're very symmetrical. I don't see any drooping of one more than the other. No cracking of the lips. So next I'm going to use my pen light and look into your mouth. Okay, I'm looking at your tonsils, your uvula. They don't appear to be red or swollen. Go ahead and stick your tongue out. The oral mucosa is pink and moist. Okay, and then I'm going to look at your teeth. I'm going to look for any missing or cracked teeth. Okay, good. Okay, so next I'm going to look into your ears. First I'm going to start with the tug test. I'm going to lightly pull in your ears, let me know any pain. Okay, and next I'm going to palpate the pinna, feel for any nodules. Okay, so the ears are symmetrical. I'm going to grab my otoscope and look further into them.
Okay.
Okay, so I'm going to start by pulling your ears back and up. I'm going to place the otoscope, and I'm looking for any drainage. I do see some earwax, but no abnormal drainage. The tympanic membrane, it looks pearly white. It is not bulging. Okay, good. So we will do the same on this one. Back and up. And the tympanic membrane, again, is pearly white, no bulging membranes. Some earwax is noted, which is a normal finding. Okay. Next, I'm going to assess the cardinal movements of your eyes. I'm going to look into your pupils, okay? Go ahead and look straight ahead. Okay, good. So your pupils are round, they're reactive to light. I would say the pupils are a 4, and then with response to light, they go to a 2.
Okay.
Next, go ahead and follow the tip of this pen. It's going to go towards your nose to check for accommodation. Okay. And go ahead and just follow the tip of this. Now I'm going to check for a hearing test. I'm going to stand behind you. Go ahead and include one ear at a time. I'm going to whisper a word and you go ahead and tell me what words you hear.
Okay. Apple.
Baseball.
Baseball.
Okay. And with the vision, I'm going to do a confrontation test. I'm going to place my hands behind you and go ahead and tell me when you see my hands.
Okay.
All right, so grabbing my tuning fork, I'm going to do a Weber's and O'Brien test. I'm going to strike this on my knee, place it in the middle of your forehead. Go ahead, let me know if you hear it in the left, right, or the middle.
Okay. Middle.
So now I'm going to place it behind your ear. Let me know when you stop hearing this.
Okay.
Do you hear this?
Mhm.
Okay. And we're going to do the same to this ear.
Okay.
Okay. Do you hear this?
Mhm.
Okay. All right, Brock, well, that concludes our assessment. Do you have any questions or comments?
Mm-mm.
Okay, thank you for your time.
Thank you.